How does defensive medicine affect patient care? Imagine going to the doctor feeling unwell and, instead of focusing solely on your symptoms, your doctor orders multiple tests that might not be necessary. This is what we call defensive medicine. It happens when healthcare providers order extra tests, procedures, or treatments mainly to protect themselves from potential malpractice lawsuits rather than to benefit the patient. This practice is influenced by the fear of being sued for medical errors or misdiagnoses. While doctors want to do right by their patients, the threat of legal action can push them to take actions that may not be in the best interest of the patient. From an ethical point of view, this raises some important issues. One major concern is how defensive medicine impacts patient safety and the quality of care. When doctors order unnecessary tests or treatments, it can expose patients to risks like radiation from excessive imaging or infections from invasive procedures. These risks can sometimes cause more harm than good, which goes against the principle of non-maleficence, or doing no harm. Another issue is the rising cost of health care. Extra tests and procedures add up quickly and make health care more expensive for everyone. This can lead to longer wait times and fewer resources for patients who truly need them. It also raises questions about justice or fair distribution of healthcare resources, since unnecessary care can limit access for others. Defensive medicine can also cause doctors to avoid treating high-risk patients or performing certain procedures. If a doctor believes a treatment might lead to a lawsuit, they might steer clear of it altogether. This can mean some patients don't get the care they need, which conflicts with the professional responsibility to treat all patients fairly and equally. Communication between doctors and patients can suffer too. When physicians focus more on documenting and ordering tests to protect themselves legally, they might spend less time talking with patients. This can weaken trust and shared decision-making, which are essential parts of ethical patient care. Lastly, the stress of potential lawsuits can take a toll on doctors' mental health. Anxiety and burnout are common among physicians worried about legal repercussions. When doctors are overwhelmed or exhausted, it can affect the quality of care they provide. In the end, defensive medicine shifts the focus from what is best for the patient to what is safest for the doctor legally. To improve patient care, systemic changes like clearer clinical guidelines and better malpractice protections are needed. These steps can help doctors focus on providing honest, evidence-based care without the fear of legal consequences.